Hello, my name is Chris Rhea from the University of North Carolina at Greensboro, and thank you for virtually attending my presentation titled Cognitive and Neuropsychiatric Functioning in Former Athletes Based on Sex and Sport Type. Head trauma during sport participation has received considerable attention over the past decade, with the majority of research focusing on the short-term consequences and recovery from a concussion. While this is certainly an important area to study, there has been recent growth in research focused on subconcussive head trauma, which is defined as a hit to the head that does not result in a concussion. Over time, the subconcussive head trauma may lead to equal or greater neurological damage relative to a concussion due to its repetitive and cumulative nature. For example, Geisler and colleagues in 2012 showed that collegiate football players receive approximately 1,000 head impacts throughout a single season, and most, if not all, will be classified as subconcussive. This, however, does not necessarily mean that subclinical levels of neurological damage are not occurring that may appear later in life. To explore this postulate, our co-authors at Boston University conducted the LEGEND study, which stands for Longitudinal Examination to Gather Evidence of Neurodegenerative Disease. They enrolled 803 former athletes from a wide variety of sports and conducted assessments on executive function, depression, apathy, and cognition. Their work, along with others, has shown that cognitive and neuropsychological disturbances can be present later in life, depending on a number of factors, such as the athlete's age when they started playing sports with repetitive head impacts. However, these findings are based primarily on males, and sex-stratified analyses have not yet been explored. Related literature has shown that female athletes experience higher concussion rates, symptom severity, and symptom duration relative to male athletes, but this has only been examined in the acute phase after sport-related head trauma. The extent to which these sex differences persist later in life is an open empirical question. In the current study, the 803 LEGEND study participants were first sex stratified and then further separated into two sport classifications: non-collision sport athletes and collision sport athletes. This classification was based on the primary sport the participant reported playing. A list of the sports included in these two classifications is presented at the bottom of the screen. Given the vastly different sample sizes in each group, effect sizes were used to examine group differences using F-tests, with 0.10 indicating a small effect, 0.25 indicating a moderate effect, and 0.40 indicating a large effect. Lastly, clinical cut scores were used to provide context relative to meaningful thresholds. Presented in Table 1 are the sex-stratified data regardless of sport classification. No meaningful effect sizes were observed between the sexes. Table 2 presents the female athlete data separated between athletes playing in a non-collision versus collision sport. When comparing female collision sport athletes to females who competed in non-collision sports, moderate effects were observed for the behavioral regulation and depression scales, as indicated by the red boxes. The yellow boxes indicate small to moderate effects observed for metacognition and global executive composite scales. Collectively, these data suggest that disturbances in cognitive and neuropsychiatric functioning persist into later life for former female athletes who participate in collision sports, which is consistent with previous literature examining former male athletes. Importantly, female collision sport athletes approached or exceeded the cut scores for clinically meaningful impairment, highlighting the level of challenges these disturbances could result in later in life. While these data shed light on the potential later life challenges former female athletes may face, it is important to recognize that our sample size was limited, so the results should be interpreted with caution. Future work will focus on increasing the sample size and adjusting the analyses based on confounds such as the number of years an athlete played a sport. Thank you for listening to my presentation, and I can be reached at ckrhea@uncg.edu if you have any follow-up questions.